right, with your hand, because you don't want to cover the fellow eye. Patients start focusing on it and it can mess up your skin. So the fellow eye always has to be open, just looking wherever you point it. It's easier for you to locate, especially sulcus to sulcus.
Alright. And then...
That's 22, this 20. We used
Okay.
20, it was
20,
perfectly
okay.
fine. And here, yes, you just want to
just
kind of
hold it over
tap
the top.
it, yes. But in the future, better to soak alcohol than soak water. What we can do right now, we can actually twist this chair just a tiny bit, this direction.
Okay.
All right, we're gonna sit straight behind. Let's move this one away. In the corner, I guess, right? We're gonna bring unit closer to you. Just make sure your foot
Okay.
pedal is always available. You don't wanna look for the foot pedal while you do scan, because you start, moving around and all the supplies in your hands are
Yeah.
may shift.
Okay.
All right, so that will be closer. Yeah, is it a little bit better?
Yes.
Okay, good.
And
Recline. And in the future, sometimes you may want to dim the lights. It kind of relaxes the patient, especially
Okay.
with all the stuff in the. Well, right now we're doing video, so I don't know.
Oh,
Whatever
that's
is
true.
better for you, yes.
Okay.
But yeah, you can always turn this lamp, face it some other way.
Because these lights dim.
Yeah, we've seen some patients are so sensitive when they start squeezing when they look directly up, and the darker room is better usually.
Okay. All right, and you have your tissues.
Yes.
Okay, we're gonna do the right eye.
So to switch between eyes, if you will do the left eye, you just simply click in this field
Okay.
and will activate the left eye
Okay.
study. So it's very easy. Defaulted right.
To the right?
It's always
Okay.
defaulted to the right, yeah.
Okay.
Unless at the when you start new Zen, you choose left
Okay.
immediately, yeah.
Okay.
Alright, so let me just switch places with a little bit so I can guide you.
All right. This goes around my neck.
Around your neck, yeah. First step. Do you want to use the eye tracking software? Then I would recommend you to go to Tools and click on this, yes. Nice. Alright, so, and you're set.
Okay. So now to put the cup on, have her look down first?
Still depends on the size of the eyelids and the eyeball. You can actually ask to look up and pull lower lid. The closer
Okay.
you take that lid, the more kind of space you can open.
Okay.
And chin slightly up. Right?
Yeah,
You
we
will want to
want
make sure
the-
the face is parallel to the floor. If it's
Okay.
not, you're going to have a hard time filling up water and keep the kind
Keep
of
it
balance.
level.
Mhm.
Okay. And look up.
And yes, with the portion of the shell, you may kind of stretch the lower lid
Okay.
and then grab the upper lid. And ask patient look straight.
Look straight ahead. You can be a little tougher, you're not hurting. Okay.
Okay, very good. I know it's might be a
Make
little
sure
tricky at the beginning. But yeah, just make sure there's no eyelashes inside of the, not only the leak, but also if it will be in front of the transducer, you will see a huge mark on the screen. And put it on the wall of the, yes.
I don't think this is even.
Then chin slightly up, a little more, and that's it. So, or in the future, you just recline chair a little more.
Is that enough?
It should be enough. So, I would recommend you to hold the tissues, grab the shell, exactly. So now with a fellow eye, always tell patient open both eyes.
Open
Point,
both eyes
hold on a
and
second, point with the finger where to look for, right here. So
look right here.
what you want is that the eyeball is
right
actually
in this center.
straight, right?
Okay,
So
okay.
because you're gonna point that probe in there.
Okay.
So click foot pedal once. No, don't put it there yet. Grab it as close as
Close.
possible and like you know what, do it like this way, like
Okay.
this way, because you will be more perpendicular. With
Okay.
UBM, you never want to go like with B-skin. You don't want to go any other
Yeah.
way. You need to go straight down. That's it. So
Okay.
the more perpendicular you are, the better. The better the image will be. You know, the more information you will receive. And look at the screen when you get in the probe in the eye. All right. So now you need to go a little bit deeper and shift left or right in order to bring that image to the center. Just very light movements. So go up, like you kind of lost the image, so bring it up. Alright, let's just bring it up. Let's see one more time. Can I hold it for a second?
Sure.
I'll just show you. First of all, marker is nasal. Marker was slightly
Okay.
other way around. We may need a tiny bit more water, but look, like I'm gonna show you so you can see where I'm going
Okay.
with it. You see?
Okay.
That's our image right there. So, but if I'm shifting left, all right, my image is going away from the center, right?
Okay.
So kind of you will figure out that golden needle.
Okay. Can I put some more fluid in there?
Yes, you can if you'd like.
Okay.
So actually, let me help you with that.
Because I feel like I don't want to get too close.
I know. And sometimes what also will be helpful, rest this part of your hand on the forehead. Then you will be very stable and you will not have that accidental move too far, too deep, you know?
Okay.
Because I know it might be a little tricky at the beginning to have all that puzzled.
Yeah, because I'm right-handed as well, so it's just different.
See, I'm lefty, so
Ah.
but I figured both ways how to
Right.
do it. Alright, so you could be a little bit deeper, a little more. So we just need to bring that back of the lens on the screen, and just because you're a little too far from the cornea, you don't see it.
Down a little more?
Just a little more, yep. And now kind of shift it either towards you, the entire probe. Yeah, keep going, keep going. You see that the
Okay,
pupil
yeah.
is coming up. Keep going, keep going, keep going. And I think you just passed. And just come back to that point where you saw that good image. So if you see all those square boxes, so our job is to bring image right in that segment, so
Okay.
the lines will start building up. Very good, very good. Press foot pedal. Excellent. Click it again. Let's just practice more. All right, so, yep, excellent. And remember, it records 100 frames, so you have about like 2-3 seconds. If you saw that great image,
Okay.
That's.
you can click and then
You
play
do
back
okay,
and you will
Saber?
see it.
Yep. I was just gonna catch any water that
Okay.
you were gonna release.
All right, so is that good for this eye?
It's sulcus to sulcus looks perfect, yeah.
Okay.
Yeah.
All right.
So, do you understand where you need to
Yes,
go with it?
yes.
Excellent, excellent.
Uh-huh.
Because sometimes you're like, oh, I mean, why image not going to the center, right? What am I doing wrong? Which way to move with the probe? But yeah,
Okay.
the more perpendicular you are, and then just slightly shift,
Okay.
left, right,
Mhm.
up, down. Yeah.
All right.
All right.
So now just lift it up slowly.
You can just
or-
lift it up. Usually pull lowerly. Let just water go into the tissue, and yep, and then I take it out.
You didn't have any running in your ear?
A little bit, but that's okay. It's fine.
You need to clean them out.
I needed another shower this morning.
Good.
Very good, yes.
Good job.
Thanks.
So let's
Okay.
just, now let's review because we need to play with the tools a little bit, right? And
Yes.
just make sure that we are seeing the best possible image for us. So what do you need to do here? Just click on the first view. I think,
This one?
yes. And click on play button. Just review it for a second, like for one loop. Then you can stop. Stop. No, just click that stop button.
Okay.
Yeah. You don't need to use foot. Okay. So now those triangles let you go frame by frame, left or right. Right. So you can stop. Use those frames. Just
Okay.
click on it and just keep going, keep going, keep going. Because sometimes it's easier just go, you know. All right. So here we are. All right. So just let's review that few steps. Okay, the 283, 285, all right, so you're more, that's perfect image.
Okay.
All right, so now this line right here, we may need to readjust this little point and go a little further. Just grab it and keep dragging it. Because you need to identify the sulcus, which goes over there.
How far, way back here?
Well, it's hard to say. Yeah, that sounds
better.
right.
Okay.
Yeah, you may want to reduce the gain because it provides better definition of the the structures.
So it might go like right.
Yes. So and same here, I would say just you can go a tiny bit more. Yeah. And you want to go into this little gap right there, right? So you see it's going right there. So this is how you adjust that line if
Okay.
needed. And again, you probably would want to have your doctors saying, hey, listen, like, where do you think the sulcus is? Let's just double check 1-2 times, let them deal with it.
Okay.
And then you just click Save Frame on the right side. And that's it.
Okay.
Again, you can always send just this specific frame to the print, or you can create report with multiple frames. All depends on what you're doing.
Okay.
So same with the other image. Play. You stop. Go frame by frame.
It's almost a perfect line.
Yes,
Mother.
that's what we're looking for that perfect straight kind of cross, right? And then we adjust again our lines.
Just gotta have the right equipment.
Again, yes, I would say you just go a little deeper here and a little deeper over there. You may even bring this line down first because the numbers are
In the way.
on the way.
Yeah.
So, but that's pretty much it.
Okay.
And again, you save that frame, and that's it.
Okay. It's hard to see over here.
Yeah, it is hard. Yeah, that's why we usually recommend to do like a multiple lines, even from one video. You don't need to go through all videos, right? But if you can identify those parameters and compare them, and then some doctors use an average of those. And again, you can do nasal, sulcus to sulcus, or the vertical, but marker will be up, right? So
Okay, so this marker.
that marker was nasal, yes, in this scenario. So for sulcus to sulcus mainly, it's nasal or up.
Okay.
That's it. And then you finish exam. And you're done.
Nice. And then just new,
Mm-hmm. And you see all those exams are building up over there, right?
Okay.
So, and just click OK.
Judy, do you want to do my left side?
Oh, sure.
Yeah.
Okay.
okay.
Alright.
Should we like get rid of that stuff here?
So again, with the clear skin covers, you will never get such a great image. I mean, it's doable to receive a good picture, informative picture, but if you have too much pressure on the bag, you know, the bag will not lay over the cornea properly. So you will have missing parts, like peripherally,
Okay.
and you will not get good image quality, right? So it's always important to have a right pressure in it, and just, you know, I would rather avoid it. The shells
Okay.
are good enough.
Yeah.
Yeah, much easier, I think.
I think.
Seems like it.
I think so, just because the other, putting it
So
together.
just tap, yes, right
Just
there.
kind
Ooh.
of
It's okay, it's just
lay it on there.
Oh,
Yeah.
It's moving its magnetic motor in there. So.
and then you wipe it.
Mhm.
Okay. Okay.
So since we're gonna do the left eye, we're gonna click on this field right
Okay.
here.
Mm-hmm.
Right, so we're
I
gonna
guess we
start
better
this.
put some drops for you too.
Yes,
Yes,
please. Yes.
We better be nice to you. Okay.
Yeah. Honor to how many. If you really want to actually do the scan, you need to.
Okay, we'll do that. Here's some more Kleenexes. Would you want me to probably roll these out?
Oh, thanks.
Do we know where we're gonna keep this?
It's gonna be in the
So,
room where we just
left
had
eye,
it, but we're gonna
you
have it
click
on a
here,
movable table.
So it's activated, so all the exams will appear here. Alright,
Either that or in
and
the
we go
retina side.
Tools, yeah, I'll let you push the buttons
Okay,
to
so-
get to the eye tracking
We're
software.
gonna wanna do tools,
Yes,
and then
eye
this one
tracking.
here.
Mhm. And you can actually also try, go back to scan mode, right here. And open the list and go do sulcus to sulcus. Just click on it.
This?
Yeah,
Yeah.
and you see sulcus to
Oh,
sulcus.
yeah, right here.
So it will readjust the magnification of the screen as
So
well.
we should always pretty much do that.
You don't have to. I mean, high definition and the sulcus to sulcus provides pretty much the same image.
Mhm.
It just, you know, there will be slightly difference.
Okay.
Okay. And then if you want the other test, you'll have to go back and click on that again. You can-
Are you talking about like the angle test or?
Yeah,
Yes, yeah.
And then do I have to do tools again?
No,
It's already.
It's already,
done.
yep.
Okay. All right, you ready to
but just
lay back?
verify.
Yep.
Just in case. So tools, yeah, it's there. Okay.
Okay. Can't stop you. Oh, is that
It's good.
Hello.
good? Did you ever do that with the patient? And you're like, whoop,
Yeah.
whoop, whoop.
Sorry.
Okay. This here on my neck.
Mm-hmm. Tissues and foot pedals. So all you need to have all that handy.
First we put this in, right?
Mm-hmm.
Okay, we're doing this side. Can I do both? Like, kinda like
You can do
that?
both. You can do lower lid first.
Kinda like there. Does that seem?
Just move this way and straight and right eye open. Both eyes open. That's better for you to see where patient is looking at. Sometimes they close eyes, start rolling eyes up, and you're not getting the image you need to get. All right. So pour it on the side of the shell.
Can I do inside?
Uh,
Or should I?
like on any of the sides. Like
Okay.
don't go directly on the eye. Sometimes the patients don't like
Okay,
it.
you're pulling it
Am I
to,
pulling- oh,
you're
sorry.
pulling the shell to my nose and it's
Okay.
causing you to leak.
Yeah. So if you
Is
have
it?
it like this,
Okay.
or keep it straight.
Oh,
All right. And yeah, carefully pour it.
That's still leaking out of,
Leaking?
yeah.
Okay, maybe we're not on
Oh,
there.
you-
then.
Oh, hang on to it.
You wanna hold the shell, yes.
Okay.
All right, just have a little bit of kind of like tiny pressure with your hands.
Gonna
Just
have
hold it and be steady. Yep. So, it seems like water stays there, so it's good. Keep
Good.
going. Yeah, that's it.
Okay, okay,
All right.
okay.
So,
All right.
and just look slightly over here, over here, over here. That's it. Perfect.
Okay.
So you want to point the, the eye directly in the center of the,
Of the
shell. yeah,
okay.
marker is nasal,
That
that,
little,
right
that
there.
little metal part. So you can actually press foot pedal now to start it.
Just down
Just
once?
click once, yes.
Mhm.
You will start
Okay.
the light scan.
and then you wanna put your fingers down
They-
there so you
they-
That on
don't go
this
too
hand,
low.
actually,
With
yes.
this hand?
Yeah, and actually, if you can rest your hand, just rest your hand on the forehead
Okay.
first, yeah,
Yeah.
just a little further, like this, yeah. Let's just get it properly done. Yep, and now you can hold the shell, never let it go, because patient can squeeze it out. And now dip the probe in water and look at the image. So you need to be lifted up a little more. Mhm. So where's your marker? My marker is nasal. So I need to ask patient look straight.
Straight ahead.
And if you're looking at the image, you see this white line. That's you are actually seeing the part of the shell. So you're
Oh.
not really
Oh.
centralized with the probe.
Okay.
So you need to bring that to the center.
Can you bring it towards you?
Towards me. Mhm.
You
Mhm.
can-
And a little deeper. All right. So I now need to
Just straight
actually-
up.
Keep looking at my eye, hand. So if you can't get the image you're looking for,
Mhm.
lift it up again.
Okay,
Just lift completely up.
yeah.
Look, the patient's looking slightly to the left, right? So
Yeah.
that's a little problem. So, but you can fix it. Let me hold it. So if patient is not cooperating,
Mm-hmm.
you just slightly readjust the probe and go where patient is looking at. See, and I'm getting the image right here, right? So you may slightly tilt the probe. Just make sure you're perpendicular to the eye with it, to the area of interest. So you may need to tilt the top of the probe to the left. Yes.
Yay.
See? So, and you see the pupil is coming up, but it's... Alright, so bring that image back. Tilt top of the probe again, little to the left, and go deeper. Okay, not too far. No, you just pass the point, it's okay. So now kind of shift it slowly here towards this direction.
Just the top or the
No,
whole
the whole
thing?
the whole probe.
The whole thing.
I know it's a little bit hard to get the image in the center. Now again, top of the probe, tilt to the left. To the left. Keep going. So, okay, you're done. Here it's okay. So image kind of centralized. Now you need to shift the entire probe. This way or that way, because you need to find the pupil. And now a little bit deeper. Okay, and top of the probe to the left.
There you go.
Don't go any deeper.
Get your pedal.
And the pedal. Yep, that's it.
Okay, and then do you hit it again to
You hit
do
it again to
this
start the
other?
next video, yes.
Okay.
So
Okay,
again,
so
it's
you-
easier to guide patient, like if you can get that good image, lift the probe up. See where patient looking at, like point to
Okay,
slightly to
yeah.
different direction, bring that pupil straight to the center
Okay.
and reapply again. If patient is not cooperating, figure out the way with the probe to tilt it certain way so you will be perpendicular to the area.
Okay.
And again, probe, top of the probe, left, not to the right. Not to the right.
So some of the water is coming out of the shell. I don't know what's going on.
All right, just and go slightly up. You're a little bit too close right now. Okay, so just lift it up completely.
Oh, she's
No.
looking way to the,
Yeah, because the water is coming out of the shell.
No, it's
There's still
not
quite a
really.
bit.
There's
Yeah.
plenty, but I want you to look slightly to your right down. No, too much. Like that's perfect. Let's stay right there. Right there. Yep. Excellent. All right. So now try to bring that image to the center. No, you're too close to up. Lift it up. So if you see your image coming to the top of the screen, means you're getting too close to the cornea.
Okay.
So always look for that.
So
All
you
right,
want
so
to
you
go that
yes.
way.
Mhm. All right. Lift it up. All right. First, try to go with the probe itself, right in the center of the look. You immediately get an image right there. So now, yeah, that's perfect. See?
Yeah, there it is.
All we need to do just start having all those dots. Left. That's perfect.
There you go.
And click foot pedal. It will save that last video. So again, yes, practice more with this move,
Yeah.
and
Can you
don't
take the
put.
shell out, please?
Uh-huh.
Let me-
I know it's took a little longer, right? How's your eye feeling? You feel it already?
Yeah.
Yeah.
That's not great.
That down your neck.
Yeah. Okay, I'm done.
You're done, I'm ready.
We did this in
Come on, go up.
Mm-hmm.
Thank you. I'll be a guinea pig.
All right.
All right. So again, you review the image.
Like?
Mm-hmm.
And then when you see numbers, stop.
You can all stop it and now go with those frames, right? So just keep going until you get perfect alignment. How's your eye?
I'm okay.
We got a
Did you
cornea
feel a
specialist,
little more
so-
pressure or
Yeah.
pressure? Okay.
Yeah,
So that's what
and it was irritating the inside of my eyelid, I think, because it was moving around. The shell was a little bit, because it kept moving and then the
yes.
fluid
With shell,
was
we
leaking
always
down
want to
my...
be stable. Like we don't
Yeah.
want to let it go. We don't want to slide the shell. So you put shell, you stay there. That's why you have your hand leaning here, right? So to have like kind of fixation
Uh-huh.
for entire point. Once you let it go and patients start looking, it's kind of irritating the eyeball.
Yeah, yeah.
It really is.
Sorry.
Do you need another drop
I'm
maybe or
good.
something?
I'm
Gel?
fine.
All right, so this image is pretty good. Now you need to work on that line, right? So this line right here, and find your scleral, the sulcus areas. And the other side the same way. Can I bring it down first a little bit? No, just down, just to have like a better picture. Bring it down, just slightly down.
The,
Yeah,
this
just
right
drag
here?
it
yeah,
down.
drag it down, it's okay, and just see, I guess you will be right there somewhere. Maybe closer to the left.
with that?
Let's say a little more to the left, to bring this close, just a tiny bit more.
There you think?
It's hard to say,
Yeah.
that's why we do
I
multiple.
know.
But anyway, you've done this one, save that frame, go to your video number 1, because there was also, a good image right there. So again, you don't need to press play right now, just click those arrows, see if there's any better image. Or maybe that last one was the perfect one. Keep going, see it, alright. Go step back. I mean, it's not the best, but okay, keep going. Let's just, keep going right. I think this one is pretty good. We'll take it for comparison. Adjust the lines each side. I'm sorry, I keep covering the camera.
Oh, we might have been blocking.
Like that, maybe?
You want to go in this gap of the line.
Where the sulcus is.
Yes.